Hello, Fairfax County Public Schools. Good afternoon. It's Friday, and we're glad to have you here for a Fairfax County Public Schools staff town hall. I'm Dr. Brabrand, Superintendent. I'm so glad you've joined us today. Accompanying me today is Sean McDonald from HR. He's our director, and also Justin Moss, who's our director in facilities. I'm glad to have these gentlemen with me. We're going to take several of your questions today over the next 90 minutes to try to give you as many answers as possible around the issues around return to school. First, though, I'd like to make a few comments. I recognize in this moment, this is an unprecedented time for Fairfax County Public Schools. I also recognize the mixed emotions that each of us and all of us feel. I know, regardless of our feelings, we are all dedicated to the mission of Fairfax County Public Schools, serving every child by name and by need, and creating an excellent learning environment in which those kids can engage, inspire, and thrive. I know you have, year after year, proven that commitment to be the case. Today, though, we must recognize with COVID-19 that we all have legitimate concerns, including safety. COVID-19 has been and is a dangerous disease, and there remains more that we are still learning about COVID-19 here in the United States and across the world. From the very beginning of COVID-19, I, working with the school board and our leadership team, our principals, all of our staff have been working on two great principles. First, the safety and welfare of our students and staff are of paramount concern. We know we must be able to look at any return to school scenario and do it in a safe and responsible and careful manner. This includes for our teachers, our employees, our students, our families, our children, our families in Fairfax County Public Schools. The second principle is that we know we all want to return to normal. We all want to be back in the classroom. We want our students back in the classroom. We want to return to the pre-COVID days. That's not possible yet at this moment, but we do know that in-person, face-to-face instruction between a teacher and student remains the best way for our students to learn, to thrive, to be engaged, to have social and emotional health. And that is what you all have done so well for so many years. It does need to resume, and it needs to resume as soon as we possibly can. But those are the two great principles that are in conflict. That is why there is so much discussion and debate about return to school. And when we think about safety, we think about safety through different dimensions: physical safety, mental and social emotional safety, the safety of our families, the safety of our country. And these are the principles that are with us. I know right now that both points of view deserve to be recognized and validated. I will not ignore that reality. You all know that we cannot reopen FCPS as we normally would in the middle of a global pandemic. At the same time, to not offer in-person instruction is to not be able to do our responsibility to serve all of our students with the best education possible. And so that tension remains as we pursue the return to school program. I believe what we have planned, what I have offered, what the school board has provided consensus on, these two options, gives our community and to the greatest degree possible, our staff members' choice to have 2 days of in-person instruction or 4 days of all online instruction. That is the solution that I believe is still the best solution that is before us. It is a solution and approach being followed by school districts small and large. The largest, just earlier this week, New York City, following almost the exact same model that Fairfax County Public Schools proposed weeks ago. I know, and I want you to know, that all of our plans have been done in consultation with state, national, and our local health guidelines. And we continue to work very closely with the Fairfax County Health Department. And we'll be sharing more information today about those guidelines, those protocols. And after this town hall, we'll be putting up more information on our FAQs to give you more of the answers to the questions that I know you have. I think it's time to go ahead and move forward with some of the questions that you have. I hope this is an informative program for you this afternoon, and we look forward to answering again as many questions in the next hour and a half that we possibly can. I appreciate your commitment to FCPS, and let's go ahead now and start to respond to some of your questions. First, we have a big category around health and safety. And what I'd like to do is, I just shared a moment ago, we are partnering very closely with the Fairfax County Health Department as we interpret national and state guidelines to help us with return to school. Some of the principles from the Fairfax County Health Department include, how do we decrease risk? There is no risk anywhere in this country under any of the conditions with COVID-19 without having a vaccine. But we can do things, we can have practices that dramatically decrease risk. The additional next principle driving the health department and our work is maintaining social distancing. We're continuing to follow the CDC guidelines around social distancing and reviewing the additional flexibility that the State Department of Health and the state superintendent shared with us earlier this week. We can and will use cloth face coverings, and we will have a robust policy around making sure that we are a mask-wearing culture and a mask-wearing system, starting when kids get on the bus to when they arrive in the school in the classroom, and when they interact with teachers and their peers. We also know that frequent hand washing is important, and we're going to be talking a little bit later with Justin and his team about all the efforts we're doing to ensure that frequent hand washing, soap and water, sanitizer are available at multiple places throughout the school and throughout our offices. We're going to do everything we can to continue to decrease mixing of groups, while still ensuring opportunities and access for our kids to be able to have the rich opportunities that Fairfax County has always offered them, though some may be more limited in this time as we return to school, as we do both virtual and in-person instruction. Finally, and perhaps maybe most importantly, more than ever before, we have got to create a culture of students and staff. When you don't feel well, you don't come to school or work. You must stay home when you're sick. One of the things that the Fairfax County Health Department has been able to share, and we're sharing with you, and we'll have updated on our website moving forward, is COVID symptoms. Not attending school if you're feeling feverish or have chills, if you have a fever over 100.4 degrees or greater, if you have a new cough that's not attributed to another cause, if you have a new feeling of shortness of breath or difficulty breathing, or if you have a new sore throat. I'd like to go to the next slide. One of the things we want to be sure, again, with health and safety, is that you need, as staff members, to inform the school if you are sick with COVID-like symptoms. You need to inform the school if you're tested positive for COVID-19 or are being tested for COVID-19 because you have concerns based on the symptoms you have. We are also asking you to share with your school and program manager if you have a COVID positive person in your household or have some other known exposure and have been instructed to quarantine by your medical health professional. The contact investigations process is one of the questions we've heard a lot about from staff. We want to share that even more so now with you as you're making your decisions about return to school. I want you to know that the Fairfax County Health Department is committed to the contact investigations process and is hiring an additional 200 contact investigators this summer to help Fairfax County Public Schools and our entire community as we approach the fall. In the contact investigation process, if there is a confirmed case of COVID-19, the Fairfax County Health Department will work with school administration to determine a course of action for the school. The process will begin with the identification of the student or staff member with confirmed or probable diagnosis of COVID-19. if we can go to the next slide, let me go through the process, because the process is very important and people want clear answers about how the process works. First, it involves isolation of the individual, and we will have isolation rooms in all of our Fairfax County Public Schools. We will identify all who had close contact with that individual, whether it's a student or staff member, defined as 6 feet for greater than 15 minutes, contact within 6 feet for greater than 15 minutes with the individual. We will then monitor the individuals in isolation and quarantine them to break the chain of disease transmission. If there's more than one case in a school or a class, the Fairfax County Health Department will work to establish if there are connections between those cases or are they individual isolated matters. We will also not just have this defined process to share, as we've just shared with you up on our website. We want to talk a little bit more with you about the notification to families and staff. It's not just about the knowing whether a student or staff member has it, but how will others be made aware? The health department will make every effort to preserve the confidentiality of health information collected during an investigation, but they will work with Fairfax County Public Schools to use appropriate methods to communicate to the school community when there are public health actions for them to take. We must balance the individual confidentiality of the health information with the need for the public to know. And I want to say that the health department has spent a lot of time over the last several weeks providing health information and heat maps so that Fairfax County can more carefully see and understand how COVID-19 is impacting our community. That commitment, I know, will continue as we do return to school. Many of you have asked about, what about my classroom, or what about my school? How will closure decisions be made there? They will be made on a case-by-case basis in consultation with the Fairfax County Health Department. Risk assessment includes the size of the class, the extent of social distancing and interactions while the ill person was present, exposure in the area, and the location of the case. All of these items taken together will help us make the best informed decision of whether a classroom or a school or a group of schools, or if the school system needs to close. If the health department investigation determines there's no connection between cases and ongoing transmission within the school, the entire school will be notified and public health actions will be outlined, including potential closure of the specific school. I hope that is helpful information for you around safety and health protocols. We'll be putting this and even more frequently asked questions up around health and safety as we move forward. What I'd like to do now is go to some of the additional questions that you asked. We've already shared this one. I'd like to go to, what do I do if a student refuses to wear a mask in a classroom? This has been a question a lot of teachers have asked. I want to be clear that we are going to have a very robust policy about masks. We are going to have a requirement for our students and staff to wear masks, except in special circumstances. Masks are going to be required as part of getting on the bus and coming into the classroom and interacting. I will be sharing additional detail moving forward. I know people want to know specifics about what if a kid refuses to wear a mask. It will be taken seriously, and we will involve the family and the student in making sure everyone understands that this is not about trying to have a discipline issue. It's about a public safety issue that we all must be doing our part to keep our schools and offices safe. And I will be sharing additional detail on that in the days ahead. But be very clear in understanding this. It is my expectation that masks are going to be part of what our expectations are for our students and staff. I know another question you asked is, I did share earlier this week at my town hall to the community about the breaking news of additional guidance from the State Department of Health and State Superintendent around the potential flexibility for 3 feet for social distancing in some cases when not feasible to maintain 6 feet. 6 feet remains our prevailing standard here in Fairfax County Public Schools as it aligns with the CDC standards. and it will be our prevailing standard as we approach return to school. However, we will look at and review the additional flexibility that we've been granted by the state and by the state superintendent to help us as we incorporate the options of our in-person learning moving forward. I want to talk a little bit now about childcare. There's been a question by staff, how will FCPS support staff members working in person who require childcare? I want to give you an important update around childcare today. We don't have all of the answers yet, but FCPS needs to do everything in its power to make childcare not an issue for our staff members. I want you to know that we are working on developing a possible solution. It will depend on analyzing the student data for the fall that we will be finalizing next week for us to be able to commit to this solution. But we are looking very much at a solution that would allow us to provide 4 days of in-person instruction for FCPS students to go to their attending school to the children of teachers. This would apply to teachers teaching face-to-face and teachers teaching kindergarten to grade 6 students. If capacity allows, we would expand this to include school-based staff like instructional assistants, custodians, and cafeteria workers, and those who serve children in schools, for example, like school psychologists and school social workers. Safety of our students and staff remains our first priority, and the intention is looking at our building intention data, our building capacity, and need to see if this is a viable solution. And based on the current numbers, I believe this is a solution that we will here in Fairfax County Public Schools be able to offer. We're going to continue to work with our SAC to stand up our SAC programming for the return to school year. We're also going to continue to work with private school providers to see about additional opportunities for our families to access childcare. But I'm bringing to you today our intent to work on this proposed childcare approach to provide at least 4 days of in-person instruction for teachers and ultimately others who are serving in schools and serving our students. We want you to be able to come back and serve the students and have a robust opportunity to interact with them through our in-person option. I now want to turn to facilities and let Justin answer a couple of questions. Justin, we're going to start with talking about some of those screening protocols that I know you all are working to help put in place and have certainly been working with our health folks and health officials. How about talk a little bit about the screening protocols that are going to take place and how they'll be completed? Could you share a little bit about that, Justin?
Absolutely. Thank you, Dr. Brabrand. So first off, just as Dr. Brabrand said, FCPS is still working closely with our Fairfax County health officials to establish and develop self-screening processes for parents and staff members to report whether they're symptomatic or asymptomatic before entering our schools and facilities. In addition to that, as Dr. Brabrand mentioned earlier, that cloth face masks will be provided to all staff members to wear while on property. Also, we're intensifying our cleaning processes that will include the daily sanitizing of all high-touch surface areas, continuous monitoring and cleaning of our restrooms by our school custodians, the use of contracted cleaning services in the event that additional enhanced cleaning is necessary. We've also allowed through other venues to reduce the amount of grounds maintenance by our custodians to free up time during the day. And then in the evening with our evening custodians, we will provide deep cleaning throughout the entire building. Also, we will be restricting access for school visitors to appointment only, and then continue to refine this process by working with the county health officials to determine if temperature checks will be needed at given times. Thank you, Dr. Brabrand.
Thank you, Justin. Actually, while we're on facilities, let's just take a few more questions. One question is about how will rooms be configured for social distancing? I know you're busy working in our schools right now. Some have desks, some have tables. Talk a little bit about how the room will look. And I know actually we'll be putting up later today a return to school video that will show you what it looks like as you all are going to be coming back to school. We're going to be sharing that not just with staff, but also with the community. Justin, talk a little bit about how you all are working room to room, school to school.
All right, thank you. Well, Each school is going to present its own different set of challenges, but the Department of Facilities and Transportation Services has been working tirelessly to develop classroom layouts and building layouts in accordance with CDC guidelines, and we're going to work with principals and program managers at each individual site to help them develop those specific layouts that adhere to the 6 feet social distancing guidelines of the CDC and the Fairfax County Department of Health. Also, we'll work with schools and offices to help store furniture or materials on location to help free up the space that we needed to meet these guidelines.
Justin, one of the questions I think teachers have asked too is, does all the furniture need to go away? I've got some furniture in there that really helps support creating a rich learning environment. How can we work through that and try to balance the need for capacity in the classroom with some of these instructional tools that teachers have had with certain furniture in the classroom?
That's a very good question too, and the answer is that we want to work with our principals and program managers to help determine those learning needs that they have at their individual sites and for their individual programs to develop what is necessary and what is critical and put that in a structure in place that helps to meet those program-specific needs, but also meet our recommended guidance from the health department and CDC. So we will be working with you very closely. I would say in a nutshell that this is going to be a case-by-case solution.
Thank you, Justin. Let's go now to a few instructional questions that I know folks have had. One is about, will face-to-face and virtual teachers deliver the same content? Will they follow the same pacing guides? Will they follow the same grading? We're currently revising our curriculum, but the short answer on all of this is we're going to do everything we can to have the virtual and in-person curriculum, grading, and approach be the same. We want to cover the same material, whether you're in person receiving the instruction, the child is, or whether the child does virtual. There may be some times when the learning task may look slightly different in a virtual setting than it would in a face-to-face. Again, one of the important things to remember, all of our teachers, please remember that the governor made clear this year in Return to School, we are doing new instruction and all instruction will be graded. So we will, whether in virtual or in person, be continuing to have our regular grading policies and our regular use of our pacing guides. Though we have been spending time over the summer making some slight changes to those so that you can better expedite the learning for your children as they return to school. One other question on there was, will teachers providing in-person instruction be expected to deliver online instruction as well? And the reality or the answer is it's possible. It is possible that in some cases we may need to do that so that we can provide the flexibility that we want for both the teacher and for the student. It's also possible teachers will provide office hours for students on the days that they're home for asynchronous instruction. We want to do everything we can to be able to maximize the success of both our in-person and our virtual instruction. Another question on instruction is, will reading and math specialists, ESOL and special ed specialists move between classrooms through the day? Students attending in school will be moving between classrooms, and we're going to continue to have that social distancing take place while that happens. Specialists will continue to serve in person in a similar manner as prior years. Let's move away for a moment and talk about some HR issues. Sean, one question that's come up for teachers, especially as they're trying to make decisions, talk about class size caps. Have they been established for virtual classrooms? There's been talk about making class size, and I've shared that class size could go a little higher. Could you kind of update folks a little bit on that information?
Absolutely, and good afternoon. The class size caps are governed by three documents or three areas. First, Fairfax County Public Schools has a class size cap regulation that really governs the size of our kindergarten through 6th grade classrooms. Secondly, we have to follow the Virginia Standards of Quality, and the Virginia Standards of Quality govern class sizes in K through 6 and also impact our middle and high schools. And then thirdly, we have, for some of our schools that have greater need, class size standard that impacts classrooms in grades K through 3, and those classrooms are smaller. We are in communication with the Virginia Department of Education to see what flexibility would be allowed for us when looking at each of these class size areas within our division. And we're also looking at making some possible revisions to the Fairfax County Public Schools regulation around class size to maximize flexibility in order to meet the needs of our students.
Sean, I know another question that's come up for a lot of staff that are watching today is about teachers and students, especially when we first communicated this out, we're concerned, oh my gosh, I'm going to have to move to a different school. And we've really talked about how our intent is for the majority of the learning opportunities, whether it's being done virtually or in person, to be based around the school and around those who've served the school. But we want to provide, sometimes if needed, some additional flexibility. Do you want to talk a little bit more about that?
Absolutely. So our first goal is to meet the needs of the students and provide the maximum flexibility for them to have access to courses and instruction that they choose. Where there are instances where we're not able to meet the needs of student selection in a base school, we may look to coordinate scheduling across various schools. In the event that we do have to cross-schedule, teacher assignments will be based upon first interest or preference, and then as we need, make those assignments to fill out the balance.
Very good. I also have heard that the first preference would be on teacher interest and preference, and then if it comes down to there's multiple interest or multiple preference, that it would be based on seniority, which is what we've used for other teacher assignment situations like destaffing.
That's correct.
Thank you. Let's go now to some. Let's go now to a few leave and benefits questions, Sean, if you don't mind. I'd like to bring up one, the first leave and benefit question. And it says, is an application through ADA the only method for receiving a virtual teaching contract? Will FCPS provide another method for communicating underlying medical conditions that place employees at high risk, but they don't rise to the level of those verifiable disabilities according to the ADA? A lot of people are really asking questions about leave, Sean, because it's hard right now. People are torn. They want to come back, but they're also concerned about their own health or the health of their family. Can you talk a little bit about that process a little bit more and share with folks the approach?
Absolutely. So we are taking a tiered approach and looking at assigning folks to virtual teaching contracts. And so individuals that are at high risk and have medical needs will be looked at first in terms of priority for these virtual assignments.
Okay.
Individuals in that circumstance should complete paperwork through the Americans with Disabilities Act. You can go onto our website and find information about how to file a claim and reach out to our Equity and Employee Relations Office to do that. Please go ahead and do that as soon as possible. Even if you don't have your medical documentation readily available, you want to get that application in so that our team can begin working behind the scenes on the process, and also schools can begin the planning process.
Sean, I know too, one of the questions people said, gosh, it's taking a while, and I recognize under normal conditions, you know, this is not a normal condition. Typically, we only have a few people, right, who process these. These are very personal requests. There's a lot of proprietary information because of HIPAA regulations. But how can we reassure people a little bit who are in that top tier of medical concern? How can HR help reassure that we'll be getting to them and getting back to them? Can you talk a little bit about what we've done or what we will be doing to help address that?
Sure, absolutely. So our Office of Equity and Employee Relations has received several hundred requests, and they're working through those requests as quickly as they possibly can. If you do have questions about your request, you can reach out to our EER office to verify. But know that if through our questionnaire process you indicated that a desire for a virtual teaching assignment, and having a personal medical need was the reason for that assignment, that we're going to trust that is the case and then work to verify that on the back end. So please rest assured that once you've made that notation, we will be following up with you and we'll be moving as quickly as we possibly can.
So Sean, what I really hear that you saying there is, of course, we're going to believe our employees. We do need to and have to, for the regulations, require the medical documentation. But we're not going to let that get in the way over the next few days of them being able to say, hey, look, I put this in and, I want to hear back. We're going to give the benefit of the doubt to our employees and then check back and make sure that the appropriate documentation is there, is available. So I really appreciate that. Thank you so much for what you and your colleagues are doing in HR around that. One other question that's been on here is, let's just talk a little bit more, Sean, because these are some of the questions really staff are asking. Well, what would the sick leave policy be like for in-person staff? How is it different this year, or how is it the same?
So we do have a regulation that governs sick leave, and so that will still be in place for the upcoming school year. But there is a special provision that was part of the Families First COVID Recovery Act that allows for individuals to access up to 2 weeks of additional leave, paid leave, in order to care for themselves if they themselves are diagnosed with COVID, or care for a family member who may also have been diagnosed with COVID. So there is some additional paid leave opportunities available for the time being under that FFCRA that was passed by the federal government.
Well, thank you, Sean. Let's take some calls now, and then we'll go back to some questions that we know had been submitted in advance. So, caller, welcome to the Fairfax County Staff Town Hall.
Hey, good afternoon. Thanks for taking the time for this teacher town hall. I have 2 quick questions to ask.
Yes, ma'am.
The first one is, we already know there's a substitute shortage. What is the plan when we have multiple teachers out and the building needs subs? If staff members are exposed to COVID or exhibiting symptoms, and they need to be out of school for other things, will other staff have to cover classes during their planning periods if no subs are available?
Thank you for that question, caller. I really appreciate it. Listen, subs has been an issue in the 25 years that I've been part of Fairfax County. And I think it will remain one of the challenges, if we're being honest with one another, that we'll still have to deal with. We're doing everything we can right now to keep a robust sub pool and be in contact with them. In fact, Sean's actually been leading a task force around how we can do a better job with that. But in terms of our approach with substitutes, it will be an approach that mirrors really what we've done during the school year, to bring as many of our subs into the building as we need to provide support and coverage. There may be some times when we're short-staffed, and I know that that has been a challenge. And actually, Sean, tell me a little bit about the work that you have been working on with a cross team around subs, and maybe some of the things that we can look at and apply as we come into the school year for return to school.
Absolutely. We've been really focused on what we can do to not only get more subs on board to work with Fairfax County Public Schools, but also what we can do to make sure that they're feeling welcome and appreciated and wanting to return to our schools. The work group really focused on building good, strong relationships with subs to really help them understand that they play a vital role in educating children. And we want them to keep coming back and helping us to provide that service to children. My team is working tirelessly to recruit new subs to our pool. We have posted our need on social media with local colleges and universities, and we're ramping up large virtual orientation sessions to get our subs ready to take on the new environment that we'll face in the fall.
Thank you. And before I take the next call, I just want to say this to staff. If we're being truly honest with one another, the biggest indicator of whether we're going to have a sub challenge this year or not is what our teachers say when return to school begins. Substitute teachers want to support our school system. And if they see and feel that the protocols are in place for safe in-person instruction, I believe we will have the substitute teachers we need to have a successful school year. So it depends on us to provide that safe and responsible environment for you. But I also ask for you to invite our substitutes to take a look. And maybe, Sean, we can work as we have you all come back. As you know, we, through the unanimous support of the school board, have moved the school day for kids to Tuesday, September 8th. Teachers and staff will be coming back at their normal times. Maybe we can find some ways to have some of our substitutes come in and be in the school prior to the school year for just a few hours to get the layout of the land and really understand what school will look like. And Sean, I'm committing to you today that I will work with you and your pool of substitutes and with our schools and principals that are really concerned about substitutes to be able to have them do some walkthroughs of the building for just an hour or two, maybe not for the whole day, but certainly ways that we can get subs into the building prior to the first day of school to really see the environment they would come in. Let's take a caller. Caller, welcome to the FCPS Staff Town Hall.
Hi, Dr. Brabrand. Thank you so much for this opportunity. I just want to clarify, if we have submitted the survey saying we want virtual, we've notified our administrator that that's what we would like to do. What form needs to be filled out? There is a form called the COVID-19 telework request form, and there's an ADA. And I am of retirement age, and I have a family member that has health concerns. So I am just very confused, and I haven't been able to talk to anybody at HR. What form? What are my next steps?
Yes, ma'am. Well, first of all, thank you for your service, and I know you have choices to make. Let me let Sean try to provide some additional information to you.
Good afternoon, and thank you for your call. If you do yourself have an underlying health condition or of a certain age, according to the CDC guidelines, please do fill out the ADA form. If you do not meet the criteria under ADA, there is that second form, the teleworking form, that you can fill out and send in to our EER folks. Having marked on the survey what your preference is, your school will receive that information and will work through our priority system, our tiering system, to make those assignments accordingly.
Thank you so much, Sean. Let's go to another phone call. Caller, welcome to the Staff Town Hall.
Hello.
Hi, how are you?
I'm okay. My question is about particularly schools that host immersion and local level 4. I know there's going to have to be some creative solutions involving how to place teachers and students and make sure that those kids are getting those programs. One of my questions is, if one of the creative solutions is that one teacher has to teach two grade levels, so let's say we're in person and I on the Tuesday, Thursday day, I'm teaching 5th grade, but then on the Wednesday, Friday day, I teach 6th grade. What happens if we end up in a virtual setting? Because I would not be able to teach 2 grade levels simultaneously online.
Yeah, that is absolutely, that's a great question. It's definitely not in my pre-FAQs that I have the answer to right here, but listening to that, that's where we would need to work with you and, in my view, figure out how we can honor the in-person structure if we had to move all of our in-person learning into virtual. And I think that's important to say here. Our in-person structure, we would be working to retain that even if we had to go all virtual for part of the year, because one of the things we've already shared is if things dramatically increase. And here's just being honest, folks. It's possible we can return to school and have a great month. We could have a great quarter. Then in the winter, if things were to get significantly worse, we might have to all go virtual. Then by early next year, and Dr. Fauci and others are saying a vaccine has arrived, we might be able to actually bring everybody back. That is part of why right now we all feel the angst sometimes the anger and frustration. I just want to know, and we don't know everything right now with COVID-19. But I do know this staff, this leadership team, these principals, all of you will do everything we can to make it work. Let's take it. Justin.
Welcome, caller.
Hi, thanks for taking my call. My question is specifically what PPE will be given to each staff members, including IAs, custodians, specialists, cafeteria staff. Will all members be offered a face shield if desired? And will all staff members be given a N95 rated mask if desired? And about the developmentally appropriate mask for students, have we determined what that's going to mean and what extra protections will there be for staff members working with a student who's not wearing a mask, and also those staff members who are seeing multiple groups of students per day and moving between multiple schools? Will they have any extra PPE or extra protection?
I'm going to let Justin answer that question, but right up front, I want to say this. Part of the FAQs we'll be releasing later today has all of the PPE, or a large majority of the PPE that we'll be ordering, with specific timelines and deadlines for arrival and when they're coming in. That kind of information I know is going to be helpful to this staff to understand our commitment to PPE, because it is an important part of the solution to be able to have a successful return to school in person. And now, Justin, I'm going to let you go into all the details of all of the work that I know your team is doing with procurement to get the very best PPE and the most diverse amount of PPE that we need for all the situations that we have in Fairfax County. Share some of the information that you have.
Absolutely, and thank you. That was a very good question. So what we're doing, we're working collaboratively as part of our task force to establish the appropriate guidelines and measures for the PPE. Right off the bat, all staff members will be given a cloth face mask like the one I'm wearing right now. We additionally will be providing disposable masks for schools and offices in the event that students or visitors do not have their own, so that they can provide that. Gloves are being purchased. Our custodians use latex gloves as part of their cleaning duties. That we have those provided, but we also will be purchasing large amounts of other disposable gloves for staff and specific program needs. Gowns and face shields are also being purchased for additional program needs. And as Dr. Brabrand said, all of these will be itemized out in a nice list as part of the additional guidance that we're putting together. And in addition to, we said masks, face shields, gowns. What else am I missing here? Gloves? Hand sanitizer, thank you. Hand sanitizer, we're providing individual bottles of hand sanitizer for all employees, and gallon-sized pumps at building entrances and in classrooms for communal use, as well as additional cleaning products for schools for cleaning, and spray bottles will be provided with a Virex cleaning solution for additional cleaning as needed if teachers or staff choose to sanitize their areas.
I also understand, I believe that we're going to have hand sanitizer stations provided to different schools. Can you talk a little bit about that and what that might look like?
Absolutely. So these are going to be gallon-sized, self-dispensing, automatic dispensing hand sanitizing stations that when people are coming or leaving from our buildings, will be able to access those and use that without having any kind of direct contact with the rest. So these are going to be good. These are coming. We're currently in the process of providing these materials to our schools and offices right now. You should see a large portion, but most of this work will carry on throughout the rest of the month of July and into the start of school. So you will begin seeing a lot more of these materials and supplies arriving in your schools and offices.
Justin, I just want to thank your staff. I know PPE is critical to having our staff feel comfortable about returning, and it's a necessary part of creating those conditions for health and safety that we have to have in the schools and in our offices as well. So thank you for all the work you're doing to get that stuff in now so that we're ready for school in the fall. Let's take another phone call. Caller, welcome to the Fairfax County Staff Town Hall.
Hi, Dr. Brabrand. Thanks for taking my call. I'm a new mom, and I'm wondering how FCPS will be accommodating nursing mothers who need a private and sanitary space to pump during the school day. Are nursing mothers given priority if they request an online placement?
Well, first I want to say and I've got Sean here who can check me. I believe we already are required by regulation to provide a room for mothers who are nursing. That's actually something even in my own superintendent's office I have worked with, and each principal and program manager needs to work to provide that space. We're going to have that obligation to provide that space even with COVID-19. I also, in terms of being a higher priority, I don't know, Sean, if you want to speak to that. I do know that we've had some staff members asking, what if I become pregnant during the year? What does that mean? Is there any information that we could share either about a prioritization or if someone becomes pregnant during the year?
Sure. So for folks that are currently pregnant, or expecting, there is an opportunity if you have an underlying condition or a potential complication with the pregnancy or a medical condition diagnosed by a medical provider, there is an opportunity to file for an ADA as a result. For our new mothers and our new parents, you do have the opportunity to list that you would like to have a virtual assignment, and that would be considered as part of our tiering system. It would fall under our third tier of child care needs. And ultimately, parents have an opportunity to exercise various leave options. FMLA might be an option for you, the extended leave under the Families First COVID Relief Act, or a leave of absence. And we have extended our leave of absence deadline through July 24th. So if you haven't had an opportunity to file for that leave of absence, you're able to do so up through that point.
Thank you, Sean. Thank you so much. Let's see if we have another phone call. It looks like we do, and I've got some additional questions here as well. But let's take another phone call. Caller, welcome to the Staff Town Hall.
Hi, thank you so much for taking my call. I think teachers are overall frustrated and concerned with the lack of equity between the virtual option and the in-person option. I've been hearing a lot about the unsureness about what the town hall will, what the office hours will look like for a teacher who has to teach in person. So we're seeing a big lack of difference between a teacher who has to be virtual, which is 4 hours a week in front of students, or 4 hours a day in front of students, versus 7 hours a day in front of students, as well as then having to prepare lessons for students who are at home. And then the same question applies to with leave policies. We've seen people who take months to recover from COVID-19, and someone who is given the virtual option would never have to take any of their own sick leave, while a teacher who maybe is out for months with COVID in person would be drained of their own leave. So how are we making sure that virtual and in-person options are equitable across the board for all staff members?
Well, thank you, caller, for that question. You know, we're doing our best as possible to make equitable those pieces for both our staff, whether they're in person or virtual. I don't know, Sean, if there's more that we can say. We have to recognize that both structures come with their own limitations in terms of, yes, the virtual person is still being asked to do 4 days of instruction. The in-person are doing 2 days, and I recognize it's 2 days for one cohort of kids and 2 days for another. I don't know, Sean, are there other things that we can talk about on that question? I guess the biggest one that I heard there is about the leave piece. Is there any additional information we can share with that caller, or is that one we'll have to follow up on?
So ultimately, if someone is going to be away from their position, either in a virtual environment or in a face-to-face environment, the individual would be expected to submit a sick leave request and get that approved by their supervisor. So there will be parity in that both groups will be expected to submit leave as they're away. Beyond that, we would need to do some additional digging and clarify
Yeah,
further.
I think the other thing was about the office hour piece and expectations for virtual. And I'll be glad to try to get as much more additional information around that between now and next week as you're making your decision. Let's take another phone call. Phone caller, welcome to the Fairfax County Staff Town Hall.
Hi, thank you for taking my call. I'm a special education teacher and local screening chair at my school, and my question revolves around the local screening process. I haven't heard a lot mentioned about this, and having gone through when schools closed, obviously this is unprecedented. However, my question is there any information should schools shut down again entirely? It seems like testing would begin in August, or excuse me, September, when students are back in the building. However, what would happen if we have to do a whole county shutdown for reevaluations and initial eligibilities?
Well, let me say this. I can share with you, we did a SEPTA town hall on Wednesday evening, and we tried to answer a lot of frequently asked questions there. I hope you'll go to the website and look at many of those. And I know Teresa Johnson, our assistant superintendent, has been communicating with families, and we'll get some more of those detailed answers out. Summer clinic is being started up again, and next week we are reopening our administrative offices in schools and centers starting next week. We've got a return to work video that we're asking everyone to look at through MyPDE, and we'll be ready for that. But part of reopening for summer clinic and having some additional time now in August is to help try to get some of the IEP meetings done. As you know, we did do what we call temporary learning plans during the fourth quarter last year for our special education students. This year, we will be doing all IEPs. We know that we have some catch-up work to do with the evaluations and timelines, and some of the timelines have been pushed and maybe even out of compliance. But Teresa and her shop are working very hard to begin to catch up on that workload. Obviously, if we go to all virtual, we would have to figure out how we would make those meetings work. But we're committed to creating that free and appropriate public education environment this year. It is all new instruction. It is all graded instruction. So the special ed world is going to be mirrored, whether you're in person or virtual, under the same expectations as a normal school year. And we've just got to, like everything else, do the very best we can to make sure that we're doing our regular great work with instruction for our kids under some of the restraints of COVID-19. I know we have some catching up to do with the evaluations, but I hope we'll be able to get a lot of that done in August and set up the framework for a successful return to school in the fall. Let's take another caller. Caller, welcome to Fairfax County's Staff Town Hall.
Hi, I'm a special education teacher, but I'm also an assistant marching band director outside of contract. We recently polled our community about having some in-person rehearsals. 90% of our staff said that they were ready to come in. 75% of the families said that they were ready for their child to come in. But we were told that we were not allowed to have any kind of in-person instruction, even though we could follow the same guidelines as the VHSL sports that are currently working out and have been for 3 weeks. So just kind of confused as to why the decision was made, and also questions just about inequity as it relates to activities at our high schools.
You know what? Thank you, caller. That's a fair question, and I would say we've been working carefully with the Virginia High School League. A lot of the attention has been, honestly, around athletics, both nationally and at the state level. And you're bringing up an important part about our fine arts and other co-curricular activities that are a big part of getting ready for the return to school. I'm going to follow up with Bill Kern on that. I'll try to get an answer to you in the next few days. But obviously, as we return to school, we want to be able to return to some of the activities that are associated with school. And I will follow up very soon with that question. It's an excellent question, and I'll get you an answer to that by next week. Let's take a few other calls, or take a few other questions. Justin, one of the things that's come up is how will food be served in the cafeteria this year? And what do we do with students also that may have severe allergies if they're going to be eating lunch in the classroom? Yes, eating lunch in the classroom.
That's a very good question. Obviously, meal distribution and service is a big concern for a lot of our families and students. As it stands today, meals will still be served in the cafeteria, but it's going to be left to the principal's discretion on where those meals are eaten, whether it's in the classroom or in the cafeteria and other areas. As far as allergy concerns and food distribution and preparation, a lot of this is still in the works with the Office of Food and Nutrition Services, and it's depending on the ultimate return scenarios and how many students are actually available that will ultimately determine the meal distribution model that is selected.
Thank you, Justin. Sean, you know, another question that's come up is, as we're all, staff members are saying, hey, we're having to make a choice. Many have asked about the time to be able to resign without prejudice or make use of extended leave options. You talked a little bit about the leave options if they don't receive a contract where they're not comfortable. Can we talk about maybe today, can we share with staff today what would be the deadline for that? Would you like to talk a little bit about that, Sean?
So we are, your survey results or your questionnaire results will be shared with schools on an ongoing basis. And so it's really important for you to get those responses in so your schools can begin planning with the goal of sharing with teachers whether their requests for a virtual assignment will be granted by July 24th. We have made a recommendation to extend the resignation deadline and the leave of absence deadline through July 24th so that teachers will understand what assignment setting they will have and can make a decision from that point in time.
Let me take another question on here about how will exposure and positive test results be communicated to staff and students? I talked a little bit about that earlier in my presentation, and notifications will be a key component. The health department will conduct the case investigations and make every effort, again, to balance the confidentiality of the investigation, but also share the information that's necessary for the health of the community. There is a lot more detail about what that process would look like, and we will be sure to put as much of it up so that people truly understand that contact tracing process and the communication to the community. Let's see, is there another call? So let's take another phone call. Caller, welcome to the Fairfax County Staff Town Hall.
Hi, thank you for taking my call. My question is about specialists. How will FCPS protect specialists and keep specials safe? I'm an elementary general music teacher. My job is to work with students in all grade levels. While I will be diligent about hygiene and social distancing protocol, the reality is my job brings me in contact with hundreds of students. Not only am I risking my own health with so many contacts, but I could unknowingly act as a vector for the virus. This concern is heightened for me because I will be working at 2 schools next year. I could potentially cross-contaminate 2 school populations. I know I'm not alone in this concern, as there are many itinerant teachers in FCPS. Some teachers, such as those who teach instrumental music, have worked at up to 5 schools. So how will FCPS protect specialists, especially itinerant teachers?
Well, thank you for that question, caller. We are committed to doing everything we can to support our specialists and all of our staff members. We recognize that some staff members come in contact with far more kids each day than others, and we are going to do everything we can. We talked about the PPE and the health and safety protocols that we are putting in place, and we're going to do everything we can to continue to have those in place and to monitor when kids are coming, or staff members with symptoms. And so I do recognize more kids has a greater risk, so there's just no way around saying that. You are correct. But we're going to have the health and safety protocols in place. We're going to try to just maximize, again, if you have a concern, as Sean noted earlier, of your own medical, that you put that in. But we want our specialists, frankly, when we think about this, our bus drivers are going to be in contact with many different students a day, our administrators. It will be more than just a classroom. For many of our folks who are not teachers in a classroom, they'll be interacting with lots of children. Remember, too, that I've shared that we are going to have a very robust mask policy. We are going to be asking our kids to wear masks, and it will be an expectation. There will be some very limited exceptions. And so I believe that robust mask policy, which all of the medical research is saying now that masks really are one of the key ways to limit transmission, is going to be helpful and I hope reassuring to you as you engage with families. In the end, I respect that the decision that you have to make is your own, but I am going to do everything, regardless of whether you're meeting with just a few kids, many kids, or the entire school or groups of schools, to be as very safe as possible. Let's take another phone call. Caller, welcome to the Staff Town Hall.
Hi. Can you hear me? Sorry.
Yeah, we can hear you. Welcome.
Hi. Thank you for taking my call. My question is about pregnancy. I know it was briefly talked about for what people who are expecting children now can do as far as virtual, applying for the virtual learning. But my question is about what's the plan for staff members who get pregnant in the middle of the school year, since they will be considered high risk by the CDC. Is there a plan to move them from in-person to virtual, or what is the county planning on doing to ensure their safety?
Thank you. I'm going to let Sean take that. Sean, is that something you all have begun to look at in Human Resources?
It is, and thank you for that question. So ultimately, if you do become pregnant and you have concerns, you should consult with your medical provider. At that point, you have the opportunity to complete the ADA paperwork and submit that, and we'll take a look at it at that point in time. So we are asking folks that have known risks or health conditions presently to submit the forms now, but certainly if you do develop a risk factor, either through a health condition or if you become pregnant, you should then follow that process and work with the Office of Equity and Employee Relations to navigate that situation at that time.
Thank you, Sean. Let's take another phone call. Caller, welcome to the Staff Town Hall. Happy Friday.
Happy Friday, Dr. Brabrand. I've read the Back to School Guide, and I have a question about the ventilation in the buildings.
Okay.
The CDC has issued guidance about increased ventilation. I understand we talked about the way the ventilation system works, but what are we doing to address the increased ventilation? And second, the World Health Organization has guidance on aerosolized transmission. Are we working to address that guidance?
All right, I'm going to let Justin Moss talk about that. I know the World Health Organization information, that's a dialogue that's just starting to go on in the national and I guess world conversation about that. But let's talk about what we're doing in Fairfax County around our ventilation systems and what we're doing to be as proactive as we can, Justin.
Absolutely. And thankfully, Fairfax County Public Schools has always been very forward-leaning in our approach to ventilation of our schools, because we take a lot of pride in making sure that we provide a safe and comfortable learning environment and good indoor air quality in our schools. So some of the things we're doing, obviously all of our systems run on building automation, and they're designed to ventilate outdoor air into the classrooms as much as possible. But we also do regular routine preventative maintenance, including changing out the air filters on our buildings. We also have designated personnel within the buildings, whether it's a building engineer, whether it's a supervisor, custodians that walk these buildings and check them regularly to determine if there is a concern in a specific area, and then we address those independently. In the event that we identify a space that may have an indoor air quality concern, a lot of times we'll take measures, whether it's just the operation of that building system or if it's the installation of an air purification system within that area. Additionally, on the aerosol, I don't want to jump too far because this is a very emerging conversation that's taking place, but we are starting to put together a lot of key stakeholders in the operational realm to have these discussions and put together mitigation strategy. Trailers as well. Thank you, John. Trailers are something else that I know that a lot of folks really want to look at. There's a lot of opportunities. We do still want to be cognizant of the security of our buildings when it comes to opening windows. So we're very careful about that. I know that that's something that a lot of folks really want to see, but trailers offer plenty, and if in need be, we will run our schools longer at a much higher rate than the normal evening and weekend setbacks that we typically do as part of our standard protocol to help increase the amount of ventilation in our buildings and trailers.
So Justin, one nugget on that for me that maybe a lot of our staff don't know, and I'm not going to tell you that I even completely knew. our ventilation system brings in outside fresh air as part of the normal operating procedure. Is that the case in all schools or just in schools with newer ventilation systems?
For the most part, I would say it is the case in all schools. What we are phasing out is some of the direct outside air intake systems in a lot of cases and providing preconditioned air into the spaces. So you're seeing that in a lot of the new renovations with these cassette units. They call them VRFs. And so we're starting to see a lot of that, but the general concept for school design, especially in the majority of Fairfax County Public Schools, is air volume. So you're pushing a lot of air circulating a lot of air in and out of the building, and you're allowing the actual heat load of the people in those buildings to help drive the dehumidification process and the ventilation and circulation, because it requires that to drive, because most of our systems are driven based on temperature control, not humidity control. So when you get into these peak summer seasons like right now, July, August, September, and during a normal summer, I'm not going to say during this time of year with all the pandemic, but during a normal summer, dehumidification becomes a real challenge, because you're lacking in many cases that heat load within the building that you're looking for to help really increase that dehumidification process. So we do a lot of workarounds to do that, and but that's something that we are addressing a lot in the new ventilations, to provide preconditioned air into the spaces.
Great. Well, I hope that our September 8th start date will actually have less headaches for you for having those real hot July and August days that sometimes DC is known for. So
that would certainly be a benefit on my end of the world.
Great. Well, let's take another phone call. Caller, welcome to the Fairfax County Staff Town Hall.
Hi. So earlier you mentioned that, Dr. Brabrand, you said we are going to continue having that social distancing while class changes are happening in these secondary schools. And I wondered if you could talk a little bit more about how we are supposed to get 1,000 teenagers to change classes in 5 minutes while staying 6 feet apart in school buildings. And additionally, building on that, the mention with contact tracing was also that it would only be if the exposure was for 15 minutes. So am I clear in saying that if a teenage student takes their mask off in the hallway and is coughing, that any students that are exposed to that would not be traced in contact tracing? Is that a correct assessment of that?
On your second question, I don't know whether that's a correct assessment or not. I would have to follow up with the health department on that specific issue, because you're adding coughing in, and I just don't have that level of detail to answer that part. On the first part, I do want to clarify. We are going to have 6 feet social distancing as the prevailing social distancing approach in Fairfax County. We can use some additional flexibility, and we can review that flexibility of 3 feet as needed as we look at our return to school. But obviously, when we're changing in the hallways, we're not going to be able to guarantee every kid is 6 feet away, even if we ask kids to avoid very close contact. So if I said that or appeared to say that earlier, that was certainly not my intention. What we do expect is that during those class changes, kids will be wearing masks, and that we are really going to urge kids to move on to the next class, to get to the next class, and to not linger in the hallways, and certainly not engage in very close contact conversations. Let's take another phone call. Caller, welcome to the Staff Town Hall.
Is this me? Can you hear me?
Welcome. Hello.
Okay, thank you. I appreciate, Dr. Brabrand, that you say that the health and safety of our staff and students is your top priority. And I agree totally that face-to-face instruction is the best approach the way it was. And if we're going to compare the way it was to virtual learning, I totally agree with that. But I think it's important to recognize that face-to-face instruction is not going to be the way it was in 2020, 2021 as it was in 2019 and prior. And so given that, and with the likelihood that FCPS staff and students will get sick with COVID-19. I mean, maybe it's just one case, maybe it could be 100 or thousands, I don't know. But because we are planning a return to in-person instruction, there is a likelihood that somebody's going to get sick. If safety and health is your top priority, why is FCPS still pursuing an in-person return to school option?
Well, there are a couple things there. Thank you, caller, and I appreciate the candor of the question. First, I want you to know part of this is why we're giving our students and families choice. We're also, to the maximum extent possible, offering our employees choice. We've offered all of our leave and benefit policies that we shared with all of our staff, and we're offering additional opportunities for flexibility by trying to match up some of the virtual selections by our students and family with virtual preferences for our teachers. I think the reality is we have, with COVID-19, there is no risk environment. We face that with COVID-19. We face that with influenza. Many of you maybe don't know that we've never required a vaccine for the flu. The flu can be something that gets someone very sick. The flu can be something that results, even in its worst, just like COVID, in death. So we have had an environment where we have not required vaccinations or immunizations for every single thing that we know can cause serious consequences. But what we have done is put in place, and what we're certainly doing this year with COVID, which is an unprecedented situation, a pandemic, is as much to have a low-risk environment. And I think the hardest thing right now is there are risks for having children stay at home. There are safety risks to some of our children. Anyone who's ever had to do a report to CPS knows this. There are health and economic risks to our children who are not able to access food, not able to access social emotional supports that they need. So the truth is, and why this is so hard, is everywhere you turn, there are risks. There are risks in remaining all virtual. There are risks in bringing in person. And what we're in the middle of trying to do is do a very careful, methodical, balanced risk assessment and giving as much choice in that assessment to our students and staff as possible. But I absolutely understand there's no way that I can sit here and tell you that I can guarantee that there will not be a student or a staff member. Many of you know that around our community and frankly around this country want to know, why can't we go back 5 days a week? Our grocery stores are open 5 days a week. Other offices are opening 5 days a week. Aren't teachers essential workers? We have to understand what we have as an obligation to try in this moment to do everything we can to meet the needs of students and their families. And we all see it through a little bit of a different lens. All of us do. And there's multiple lenses if we're being responsible to this situation. There really are multiple lenses we're being asked to put on. I see it through the eyes of being a parent, a superintendent, and we have to see it through multiple perspectives as well. But there's not an easy answer to that question. I cannot guarantee that every staff member or every child will be COVID-free in Fairfax County Public Schools, but I can't guarantee that if we remain virtual, that won't happen either. We have kids and families, at least principals are reporting, that families even during the summer or in the spring called in, who are getting COVID in our community. So whether they're virtual or whether they're face-to-face, COVID is not going away. How long can we wait to not have some form of in-person learning for our students? And that is the question. I respect the healthy debate, and what I've tried to do, as many school districts and many superintendents are trying to do, is come with the most balanced approach possible that has health and safety at the forefront as we make those decisions. So I appreciate your questions, or that question, and I commit to you to continue to do everything possible to make the conditions for return to school as safe and secure as possible. Let's take another question here. And let me see a couple of questions maybe we still haven't answered that were frequently asked questions. One is, what platform will be used to provide distance learning? We're going to continue to offer Blackboard Collaborate Ultra and Google Classroom for our learning management systems. We're also looking at piloting, we're piloting Schoology in a few of our schools, which will become our new learning management system over time. I know that was a question. We've asked about laptops for kids. As you know, our middle and high school students had FCPS on last year. They all received a laptop, and they will have it again this year. The school board supported earlier this spring, right as COVID hit, the expansion of FCPS on to all of our middle schools, and we will be giving them access to brand new laptops. And we have purchased an additional over 20,000 laptops for our elementary schools, so everyone in elementary school can have access to a laptop if they need it. Let's take another phone call. Caller, welcome to the Staff Town Hall.
Hello?
Hi, hello, good afternoon.
Good afternoon. How are you?
I'm good. Thank you for calling in. What's your question?
Yes, I am a transportation employee, and I have two questions. Question number one, I understand that teacher has the option to choose to teach virtual, online, or in classroom. What do transportation employees have the choice to choose, or do we have any choice? And the second question is, what are being done on the buses to protect the drivers and students?
Sean, do you want to talk a little bit about the first question, and then Justin, I'll let you go and answer the second.
Sure. So thank you for the question. Any employee that has their own personal health condition that might put them at risk can complete the Americans with Disability Act, the ADA form, and request an accommodation. Our team in EER will engage in a conversation with you around what accommodations may be necessary and work to see if we're able to provide those accommodations. Individuals also have the opportunity to look at, if we're not able to accommodate you, an opportunity to take a leave of absence for this period of time.
Thanks, Sean. Justin, could you talk a little bit about precautions for our transportation folks?
Sure. And our bus drivers are absolutely no different than in our classrooms or in our office settings, and the same precautions are being taken, although slightly modified due to the function. But if you discuss with Francine Furby, our Director of Transportation Services, you'll know that we're developing social distancing on buses with a category of reduced capacity in our school buses, the same that we would have reduced capacity in our classrooms. Our bus drivers are being provided with PPE that includes potentially face shields, gloves, and hand sanitizer, as well as bottles of Virex solution to clean their buses between each route. So the same measures that are being instituted in our schools and in our offices are being instituted in our school buses.
Thank you, Justin. I just want to say on that, we need all of our Fairfax County Public School employees. We need you to be able to be successful in this return to school. You do have choices to make, and we respect those choices. We're doing everything we can to make sure our schools, our buses, our offices are safe and secure for you. And we are doing everything we can to be sure that we can be there for our students and families in Fairfax County Public Schools this fall. Let's take another phone call. Caller?
Yes, hello. How are you?
Good. Hello.
My question is twofold regarding safety. The first one is, I understand you are talking very strongly about a culture of masks, and I appreciate that. And masks are very effective. But as a teacher, and this is not supposed to be a discipline issue, so if the student refuses to put on their mask, are we allowed to tell them they cannot come into our classroom? And my second question is, will the ventilation documentation be available to the public?
Let me take your first question. Thanks for that question. I am going to be bringing to the school board on Monday a policy around masks so that we can get the clarity that you're asking for in the question. I do agree, as you just said, that we need to be very careful that we don't turn school mask into a discipline issue. It is a health and safety issue. And that there are only going to be exceptions in very limited circumstances. I think we need to be able to give you additional clarity about a student who simply, for other reasons, will not wear a mask in your classroom. And I am committed to providing that kind of clarity and feedback to you. As I said, I want to bring a mask policy to the school board, and I will on Monday, so that this conversation can get the clarity that you and others want as we do return to school for the fall. Let's see if there's another caller. Caller, welcome to the Staff Town Hall.
Hi, thank you so much for taking my call. I actually have a three-part question. As somebody who teaches a FACS hands-on cooking course, I'm curious to know how these classes will run if students will able to touch the products they make and or eat it. Have you considered a stipend for those teachers who are working in person, whether it's for covering extra PPE, scrubs, or whatever gear they might want to wear? And lastly, what is the threshold with which you all are gauging, you know, whether it's a number in your mind or the number of schools impacted as to when to shut it down and switch to virtual? And again, thank you for your time.
Hi, thank you so much for.
Well, thank you very much. You know, I will have to get back to you about the food and nutrition protocols around touching the food and eating the food. Look, it's a key part of your classroom experience. And I think as much as possible, we need to figure out how we can continue to honor that. I know that's a question we've gotten from teachers, for example, who want to use manipulatives and continue to use those. And how can we personalize that list? I'm also working with the Education Foundation. We do supply list every year, and whether we take a real look this year, whether we need more glue sticks or do we need to create a personal supply list for kids that may include instructional pieces that they can have as their very own and use those each day in the classroom without having to share them. So I don't know what that would look like in the food and culinary world about having almost a personal set of supplies to doing your work, but that is something that we need to get further detail on, and we will. The other question that you had was around, and now I just forgot what it was around ventilation requests. And Justin, can you talk a little bit about you know, ventilation and documentation around ventilation issues?
Sure. And I know a previous caller had asked if the ventilation information that we shared today would be provided publicly, and the answer is yes. This information is already being added to our FAQ list. In addition, I believe some draft information is being prepared as we speak for our principals to go out to provide them, and that includes information on what FCPS is doing to increase and provide sufficient air circulation and ventilation within our schools. So the short answer is yes, it will be provided.
Thank you. Let's see if there's any other callers. I think we have just a couple more. Caller, welcome to the Staff Town Hall. How are you this afternoon?
I'm good. How are you?
Good.
So my question is around maternity leave for teachers who are pregnant already and who are expecting this year. Ideally, from what I've heard, most pregnant teachers are putting in for virtual learning because of the CDC's addition to pregnant women on their list of high-risk people. So my question is, if I am teaching virtually and I go on maternity leave, what does that look like in terms of, does someone take over my class, virtual-wise? And if I don't get approved for a virtual assignment and I have to go in person, what does that look like for maternity leave for somebody taking over my class in long-term sub-wise?
Sean, go ahead and take that one for me.
Thank you for the question. So we will be, like any other year, providing substitute teachers to fill in when a teacher's away. And so what you'll need to do in either environment is submit a request for a substitute, a long-term substitute in that case. to ensure that your students have a teacher during that period of time. We will be training a group of substitutes to be able to navigate the virtual learning environment so that they understand how to utilize the technology and some strategies that will help them be successful in that environment.
One of the questions I know that previous caller had, who asked 3 questions and I only answered one of them, was around what's the criteria to close a school? This has come up multiple times, and it's a question that we would all want to ask. What is that criteria? And we've worked with the health department, and it depends on the nature of what is found in the contact investigation. That is the most direct and candid answer that we can provide. That is the answer that the health department has shared. We have to explore the nature of the contact investigation, and that will determine whether we have an issue that is in isolation or a massive amount of community spread going on in the school. The issue of criteria is something we will continue to have the health department share with us as we move forward, and I can just tell you that we're going to continue to be great partners with them to communicate the latest guidance and information that they have. And we're going to use their guidance to help us make decisions, while the ultimate decision around closing a school remains with the superintendent in consultation of course, working with the school board. I am aware of the need to try to be as clear as possible when we are seeing significant issues around transmission, that we're going to share that with the community and make the right health decisions. Let's take another phone call. Caller?
Hi, yes, thank you for taking my call. I have 2 questions. The first is simple, the second may not. With the application of the ADA being for people now being COVID related, has any thought been given to changing the 2 forms to make them more relevant to this particular situation and thereby more easier to complete? And the second question is, if teachers apply for either an ADA or the telework option based on the tiers and they're denied, can they then rescind their request and teach face-to-face, since some of the other leave options are not financially viable, since this is a unique situation for even being able to apply for the virtual space?
Sean, do you mind taking that question?
Sure. Thank you for your question. So the form that we do supply for ADA is based upon some information that we do need to collect as part of the legislation or the law, the federal law, the Americans with Disabilities Act. And so we are always looking at our forms and making adjustments as needed to ensure that they're clear and folks understand what we're looking for. Ultimately, in this case, and I just want to revisit something I mentioned earlier, if you do have a pre-existing condition or are at risk and complete that form, please get that form into our Office of Equity and Employee Relations as soon as possible and follow that up with your medical documentation. Ultimately, your medical provider will need to supply some sort of notation that you do require an accommodation.
All right, we're going to take one more call for our town hall today. We appreciate everybody calling in. Caller, what's your question?
Hi.
Hi.
My question is, as a parent of an FCPS student, I am an FCPS staff. My husband is also an FCPS staff. And just in terms of stakeholders and transparency, I would be interested in having the survey data actually publicized on the FCPS website. So in-person versus virtual, with a little ticker tape going below for that data per school.
Thank you, caller. I can commit to you that we can put that information up. I don't know about ticker tape form, but I certainly know that we can provide you what that information looks like, and I will work with our communications department to share that information as soon as possible. So thank you for that call. I want to thank all of the staff members who've called today. I want to thank Sean and Justin for joining me. I know even today, I know the FAQs that we've provided, and again, many will be going up today. I commit to you, I am going to continue to work to share with you all the available information that we have and do everything I can to answer the questions that you have so that you can make an informed decision as we return to school. I know these are unprecedented times. I know this is not a moment that you or I ever hoped for as educators. But in this moment, I still remember the superintendent who was here when I arrived over 25 years ago. Bud Spillane, who was National Superintendent of the Year, said again and again, the main thing is to keep the main thing the main thing. And when Bud talked about the main thing, he talked about our students. Our students need us more than ever before. Some need us in a virtual format. Some students need us in face-to-face. COVID is here, and it has changed our world. But our students are still here, getting ready to enter kindergarten for the first time, to enter middle school for the first time, getting ready to have their senior year. We can and will be here for our students, and we can and will together, listening to each other, learning from each other, and leading together on behalf of our students, we can keep the main thing the main thing. Have a good afternoon, everybody. Have a wonderful weekend, and we will see you soon.